I'm here with Dr. Bobby Kapur. Dr. Kapur is the medical director of the Free Clinic in Washington. And Dr. Kapur, I think we just saw our first patient taken to the emergency room.
That's correct. We just had a gentleman who doesn't have any health care, lost his insurance recently when he lost his job, and was actually just today diagnosed with diabetes, did not know he had diabetes, and because he didn't get regular checkups, had a family history of diabetes, and today's event actually uncovered that diagnosis.
And what was the reason he had to go to the emergency room?
Because his blood sugar was critically elevated and was on the verge of possibly going into a diabetic coma if he stayed at that level for much longer.
And how long have you been without health care?
Exactly, I'm not sure, but I know it's quite a few months.
And if this gentleman had regular access to a doctor?
Yeah, if he had regular access to a doctor, we'd probably have had routine health care and routine screening for his diabetes. And this is only just a tip of the iceberg. I mean, gentlemen like this person and other, millions of other men, women, and their children across the country, they need regular screening for high blood pressure, for diabetes, for asthma, in addition to just general cancer screening, such as breast cancer and prostate cancer.
And so the fact that as a nation we don't provide this, and a gentleman like this man who was being taken to the emergency room, what is the cost to our healthcare system of all of this screening that's not happening?
Yeah, I work as an emergency medicine physician in Houston at a very busy level 1 trauma center, and the majority of our patients are uninsured. And I get to see on the front lines the ramifications of our healthcare system not functioning at its full capacity or not providing access to care to over 50 million people. So instead of providing what we could say pennies a day cost to do prevention and screening and catching these problems early and then providing their chronic medications and their prescriptions, these 25 to 50 million people who have chronic problems, they show up with exacerbations or acute problems from their problems. And what could be maybe $5, $10, or $20 a visit payment all of a sudden becomes $1,000 a day hospitalization for days or weeks.
So this is truly penny wise, pound foolish.
This is truly that.
And Dr. Kapur, we now have the Patient Protection and Affordable Care Act, and there are a variety of what the government is telling us are immediate benefits. How, if at all, is this impacting this population of patients who access free health clinics?
That's an excellent question. I think some of the immediate impacts on the bill that was passed this past March are primarily basic stopgaps for just a very small segment of the population. This may include students who were on their parents' insurance plan. It can then be extended a bit further, and it can also prevent patients with prior medical conditions from being denied coverage. But for the overwhelming majority of people in our country without health care insurance or access to health care, the bill doesn't provide them any access immediately, and those provisions probably won't be implemented for another 4 to 5 years, and really won't see the true benefit of that legislation for some time to come. And not to mention the judicial review of this bill that's occurring. First cases in Virginia and other states to follow. We're not even sure if this bill that was passed will actually be implemented in its full course.
So what's going to happen to these people between now and 4 to 5 years down the road when hopefully there'll be some more health care available to more Americans?
Well, fortunately, there are safety net provisions out there, such as our free clinics and our charitable clinics, which do provide health care for those individuals who are uninsured. And the reality is the landscape of the uninsured looks like pretty much the landscape of the United States. We've got all segments of the population by age, ethnicity, demographics, even income levels. And as you know, most people know, our health insurance in this country is employer-based. So if you lose your job, you lose your insurance. And oftentimes in a family, one person who's employed covers the entire family. So if one person loses a job, you may see an entire family, 3, 4, 5 people, lose their coverage. In addition, a lot of small businesses, to cut their costs in the time of a recession, have had to cut back on benefits. So if they were able to hire 50 people and with full benefits, but then because of the recession, they had to make the options between either keeping all 50 on board but cutting off health insurance, or firing 25 and keeping the benefits. So most companies are saying, we'll keep people employed, but we're just going to reduce the benefits and reduce the coverage.
One final question, Dr. Kapur, because I know you're very busy. All 100 members of the United States Senate were invited to come today and walk around and meet you and understand this problem of people who don't have access to health care. Not one is showing up. What do you have to say to this august body?
Well, the reality is that the healthcare reform bill did pass in March, and we appreciate the support of those members of Congress, both the Senate and the House, who did vote in favor of healthcare reform. Our fear or concern is that once the bill has passed, that it's now this topic has gone off the table. Now we're moving on to other issues. But the reality, as I said, is that these provisions are not going to come into play for many years, and that there still are, at this moment, in August 2010, 50 million people without access to health care.
Right. Thank you, Dr. Kapur, and thank you for your, and it looks like you've come all the way from Texas to be here.
That's correct. I used to practice for 5 years in D.C. Now I've been in Houston, Texas, at Bentop General Hospital for the last year and a half, and still can practice here in D.C. and glad to be back.
Beautiful. Thank you very much.
Thank you.